Hey everyone, today's lecture is going to be on Rasmussen syndrome, which is a pediatric neurodisorder. Before Tuesday's class, I'd like you guys to be able to answer the following learning objectives. And I know I'll be going a little bit fast, so feel free to pause and rewind if need be. And I'll also be sprinkling in a few questions throughout the presentation, so please feel free to pause it while you think of your answer and then resume whenever you're ready. So Rasmussen syndrome, which is also known as Rasmussen encephalitis, is a rare chronic neurological disorder characterized by unilateral inflammation of the cerebral cortex. Symptoms include frequent and severe seizures, which in 50% of cases are known as epilepsia partialis continua, which is a condition where seizures are very frequent, so they're happening within seconds or minutes of one another, and they're continuing for an extended period of time, which can last for days or weeks or months. There's also a loss of motor skills and speech, and this can vary depending on which side of the brain is affected or where it's actually taking place in the brain. Most children that are affected tend to have some motor or speech deficits. Also, hemiparesis, which is weakness on one side of the body. And here's your first question. If the right side of the brain is affected, would you expect the right side of the body or the left side of the body to have weakness? Contralateral side, so you would expect the left side to be affected. And also encephalitis, which you might be able to guess from the name, but it's inflammation of the brain. And who is affected? As I said, this is a pediatric disorder, so it's usually between the ages of 14 months to 14 years. However, it is pretty uncommon under the age of 2 and over the age of 10. The majority of children, or the median age, is around 6 years old. There have been about 10% of cases that are adolescents or even adults. The oldest person with this disease was diagnosed in their 50s. However, anyone that's older has or tends to have milder symptoms. Since 1958, when this disorder was first described by Theodore Rasmussen, up until 2000, there have said to only have been 100 cases, and the annual number of new onset Rasmussens has been estimated as 2.4 for every 10 million people that are less than or equal to 18 years of age. So causes, recent studies show that it might be an autoimmune disorder, and it might be triggered by some kind of unidentified infection like the flu or measles. More notably, we know that there is an increase of T cells, microglia, and astrocytes in those with the disorder. And as we know, all of these cells target toxins or something that they don't think should be there. So they are fighting against something. And in some cases of Rasmussen's, there have been an increase of ionotropic glutamate receptor, which is serving as an autoantibody, meaning that the person's body is creating it to fight something, and that something is its own body. And this is typically found in the plasma or the cerebral spinal fluid of patients with Rasmussen's. So as I said, there is a lot of atrophy. So as you can see here, on the right side, you see a lot of neurons, and then, on the left side, you see all the neurons, and on the right side here, you see a lot of degeneration and neuronal loss. Here again, as you can tell in this image, it looks pretty similar to what you see over here. So it is an almost complete loss of cortical neurons, and then the same area has now been stained for glial fibrillary acidic protein, and it shows a strong activation of astrocytes. Similarly here, you can see an activation of microglia, both here and just around the cells. And then in an actual MRI scan, what stands out to you guys? Besides obviously what is being pointed to as this large atrophy on which side of the brain? The right side. So where would you guys expect the symptoms or the weaknesses to be? On the left side. And then what else do you guys see besides this obvious mass? I'm seeing some enlarged ventricles. and then some atrophy to something that should be here. I see it on this side, I see it this side, I see it on this side, but I don't see it on this side. What do you think this is, and what do you think it would be affecting? Caudate nucleus. Your exam is coming up, so make sure you're able to know exactly what is being affected in MRI images and what symptoms it would create. So to diagnose someone with Rasmussen's, clinically, you're going to be seeing a lot of seizures. That's the most common and first noticed symptom. In an MRI, as we just saw, you'll see some progressive unihemispheric atrophy. And then in terms of the histology, you're going to be seeing a lot of T cells and activation of microglia and astrocytes. Treatments, any anti-seizure drugs have not been found to be effective at all in treating seizures in people with Rasmussen's. Immunotherapy, they have been working on, and there have been some improvements made. However, we don't know what the long-term effects are, and nothing has been shown to cure this. Surgery, specifically hemispherectomy, is the only cure we know for seizures for Rasmussen's. However, in certain cases, after they were thought to have been cured, the seizures end up spreading to the opposite side. That's not as common, however, it has happened. This next couple slides, I don't want you guys to memorize, and I don't need you to know much of anything about the specific medications. However, a lot of the immunotherapy medications are targeting specifically the T cells, trying to prevent them from going in and attacking the brain, and then also inhibiting microglia and astrocytes from going in and attacking the brain. And then, as I said, the hemispherectomy is the only thing that's really been shown to fully cure the symptoms, and it does seem like a drastic measure to take. However, this is only really done in children with very severe seizures, and because of the neuroplasticity, they're usually able to regain most of their functions, and the opposite side of the brain is able to take over, and they're able to live mostly normal lives. So I know this was pretty quickly, but please email me with any questions you have before Tuesday's class. And obviously I'll be in class to answer any questions if you don't think of anything until Tuesday. Thank you very much for watching.